Our guest this evening on the show is Dr. Todd Austin. Todd is a 1993 graduate of Logan College of Chiropractic. He's been serving northern Macoupin County as a chiropractic physician at Austin Family Chiropractic in Virden for the past 17 years. Todd is also the official team chiropractor, as well as the team trainer for the semi-pro Springfield Foxes football team. But besides treating high-performance athletes, Dr. Todd also cares for weekend warriors as well as everyday people who aren't athletes. One of the areas in which Dr. Austin specializes in providing effective alternative care for a condition known as plantar fasciitis. In fact, Todd even did his senior research paper in chiropractic college on that very subject. Dr. Todd, please tell us, what is plantar fasciitis and what are the symptoms?
Plantar fasciitis, commonly known today as PF, is a condition of the feet, of the bottom of the feet. It can be an acute issue, it can be a chronic issue, meaning someone has had it for years, and it can be very debilitating. It can be, a very debilitating issue that can bother someone from the time they get up to the time they go to bed, and literally wake them up at night too. So that's what plantar fasciitis is. It's plantar means bottom of the foot. Fascia is a connective tissue is a type of connective tissue on the bottom of the foot. Itis means inflammation. So if you break the Latin into English, it means inflammation of the fascia on the bottom of the foot.
What is one of the main symptoms?
One of the main symptoms is your feet can hurt like heck. They can burn. There can be numbness. Any of those things.
I understand that you suffered from plantar fasciitis. Can you please tell us what methods you used to overcome that?
Okay. I suffered from plantar fasciitis originally in 1985 when I was in basic training in the service, and went on sick call, and the doctor gave me these little glue-in arch supports for my boots, which have no arch support in them whatsoever. And so that seemed to help for about a year and a half. Then it came back with a vengeance. It would have been 1987, and I suffered with it probably till about 1992.
Wow.
It was both feet. It was severe on a scale of 1 to 10. I'd say at times it was a 12 or a 13. And I went to basically the first 4 doctors I went to had no clue what they were doing. And finally, it was salved by a combination of hypnosis for chronic pain, needle acupuncture, chiropractic, spine, pelvis, and knee and feet adjustments, and wearing chiropractic orthotics support in my shoes. Those are the things that took care of it, but it was a long road.
Since 1992, I'm sure there's a lot of new inventions and a lot of new treatments that are available. Can you share with the audience some of those new treatments that are available now?
Exactly. So I already talked about how I overcame my plantar fasciitis, but since that time there are a lot of new treatment approaches out there. And as a chiropractor, I use several of those, Jackie. So one of those is cold laser therapy, which is one of my niches in practice, one of my passions in life actually, is cold laser therapy. So with specialized cold laser light photons, we are able to decrease pain, swelling, edema, and inflammation, increase range of motion, speed up the healing process, and we can do all of these things relatively quickly. And then another thing that I'm very fond of is putting my patients on very high doses of fish oils, usually about 9 grams of a good quality omega-3 fish oil on a daily basis. That will really help to bring down inflammation quickly as well, anywhere in the body, obviously including the plantar fascia. So another thing that I like to do is to find, when we examine a patient, we check for trigger points in their calf muscle, something that we didn't know about 20 years ago. And typically these people don't even know they have these points in their calf muscle, but when I find them and pinch on them, they about jump off the table.
Right.
And so what we'll do is we'll teach them how to find those points and massage those points. Ideally, if they can bring their spouse in with, I will teach their spouse how to do those points.
For home treatment?
For home treatment. I will tell you, whenever I've had a PF flare-up, which I've had maybe 3 times in the last decade, just for a day or two, I stick a towel in my mouth, and my wife, who's a massage therapist, she gets on those points, gives it all she's got, and I literally have tears in my, but it helps. It works beautifully.
Right.
And then the last thing is a thing called kinesiology tape or kinesio tape. So that works really well with plantar fasciitis. I will tape people in the office after I've lasered them, and then I will also teach them how to do the kinesio tape work at home, so they can go home and they can tape themselves as well.
Right. And for you audience members, I too suffer from plantar fasciitis and was lucky enough to have a cold laser treatment from Dr. Todd, as well as learning about the KT tape. And I have had a lot of success in the healing of my illness with plantar fasciitis. Dr. Todd, do people that suffer from plantar fasciitis attend podiatrists or medical doctors, or should they attend a chiropractic office?
Okay, that's a great question, Jackie. And early in the video I talked about I went to 4 doctors that really had no clue what to do. The first of those was a medical doctor who just pretty much threw some drugs at me that didn't help. The second doctor was a podiatrist who threw more drugs at me, bigger, better, badder drugs that didn't help. The third doctor that I went to that offered me no relief was another podiatrist. He tried more drugs, they didn't help. Then he tried cortisone injections and they didn't help. And then the fourth person I went to was another podiatrist who was a really good sales guy. And this podiatrist told me I needed a surgery. He actually told me I needed 2 surgeries, but we'd start with 1 foot so I could be on crutches instead of a wheelchair. And not only did that surgery cost $3,000 and actually did nothing, and I had no health insurance, but he accidentally left me with a parting gift, and that is he accidentally cut the nerve that goes to my big toe. So since the age of 22, I've had arthritis in my left big toe. So luckily I have supplements that help me with that. But my take on that would be you need to find a chiropractor who specializes in extremity adjustments. Like some chiropractors only adjust the spine, but a lot of them also adjust the knees, the hips, the feet and the ankles and the heels as well. So I would recommend that. If you know a chiropractor who does cold laser therapy or does KT tape, then that would also be a benefit. And a lot of the other specialties really don't do that sort of thing. So my answer would be the best doctor, in my opinion, to go to would be a chiropractic physician.
Great.
For your plantar fasciitis.
Well, thank you, Dr. Todd. Thank you, audience members. We hope that you go away with a little bit of knowledge. And if you're suffering from the symptoms of plantar fasciitis, you'll go away with a little bit of hope that maybe you can have a cure as well. Thank you for joining us today.